Good morning, dear students. Now let's discuss about drug interactions. You know the meaning of these two terms. Uh, Drug. You know what is a drug? It's a drug. Drug is the substance used for diagnosis, prophylaxis, or treatment. And interaction. What's the meaning of interaction? Inter means inter and action. They will be reacting. So that is drug interaction. In this after completing this topic, you should be able to define what is drug interaction, what are the various mechanisms of drug interaction, next types of drug interactions. Also, you should be able to tell about the pharmacokinetic drug interaction with example, pharmacodynamic drug interaction with example, and also pharmaceutical drug interaction. Hope you're clear. So, after completing this chapter, you should be able to define what is drug interaction, mechanisms of drug interactions, types of drug interaction. And then the types are pharmacokinetics, pharmacodynamic, and pharmaceutical. So these types you have to be thorough with various examples. Okay, so first let's start with the definition of drug interaction. What is drug interaction? What you are thinking about drug interaction? Drug interaction means if you are telling simply, we can tell if you are taking two or more drugs together, one drug will be interacting with the other drug and will be modifying the response further. That is the simple definition, and we can see the exact definition. What is that? If you are taking two or more drugs together, you are not taking a single drug, you are taking two or more drugs, one will be interacting with the other and it will be reducing the response of other drug, or it may increase the response of other drug. That is drug interaction. So what is drug interaction? Drug interaction refers to modification of response to one drug by another. Okay, so there is modification of response to one drug by another when they are administered simultaneously or in quick succession. I hope you're clear. Drug interaction refers to modification of response. This term you should remember, modification of response to one drug by another when they are administered simultaneously or in quick succession. Okay, what is drug interaction? Drug interaction means modification of response to one drug by another when they are administered simultaneously or in quick succession. And now what the modified response will be? The modified response will be either quantitative or qualitative. Quantitative means we will be getting an either increased response or decreased in the intensity of action. Qualitative means we'll be getting an abnormal or different type of response. So the modified response, after once drug interaction occurs, the modified response either will be getting a qualitative effect or will be getting a quantitative effect. Quantitative effect in the sense the response will be either increased or decreased. Qualitative means will be getting an abnormal or different type of response. Actually, one of the main important role of clinical pharmacist is prescription monitoring. What you have to do will be therapeutic drug monitoring. While doing the drug monitoring, you'll be going through the patient chart and will be seeing whether there are any chances of drug interaction. If the patient is taking these drugs together, whether any drug interaction occurs. That the main role of a clinical pharmacist. Okay, so you should be very thorough with this drug interactions. And we know this is just an introductory part. Okay, and for studying what is this drug interaction, we know many conditions we are treating with a combination of drugs. For example, you're getting fever and you're having some body pain. The fever may due to some infection. So what you'll be taking, will be taking an analgesic with an antibiotic. For antibiotic will be treating the infections and the analgesics will be treating the painful condition. So one effect will be complemented by another thing. In many conditions we are treating with a combination of drugs, and how we are selecting the combination, we are selecting the combination in such a way that one will be complementing the action of the another drug. The examples are antibiotic with analgesics. We know when you are getting an infections, when you are getting fever or some chest infections, respiratory tract infection and all, you used to take some antibiotics. Along with that, you used to take some analgesics also. Similarly, we use adrenaline with lidocaine. We know adrenaline is a vasoconstrictor and lidocaine is a local anesthetic. Lignocaine, while taking lignocaine as local anesthetic, we used to take adrenaline to produce vasoconstriction, so that the effect of local anesthetic will be confined to the particular area. Similarly, if you take some antitubercular drugs, TB, you know TB is caused by Mycobacterium tuberculosis, and in TB we are not treating TB with a single drug, we are treating TB with a combination of drugs. That's the purpose of treating TB with a combination of drugs, to prevent the development of bacterial resistance. Similarly, if a person is having mixed aerobic and anaerobic bacterial infections, we are giving a combination of antimicrobial. Similarly, we can see if you see the prescriptions, like your grandparents' prescription, they'll be having so many diseases like hypertension, diabetes, cholesterol, everything will be there. So they are supposed to be treated with so many drugs. For reducing the blood sugar level, we have to give an anti-diabetic drug. For reducing the hypertension, we have to give another one drug. Then for cholesterol lowering, we have to give statin. So we are supposed to give a combination of drugs, and in some conditions this drug interactions are desirable. Example is in case of hypertension, you know, various drugs like ACE inhibitors, then calcium channel blockers, beta blockers and so on, and we will be giving a combination of drug like ACE inhibitors plus diuretics to treat hypertension. Diuretics will be increasing the elimination of urine. Similarly, some drugs like sulfamethoxazole and trimethoprim, this is our antibiotics. They are used in bacterial infections. And furosemide is a diuretic, and this diuretic, while you are giving, there will be potassium loss. To prevent the potassium loss, we will be combining with amloride. Amloride is a potassium sparing diuretic. Okay, so this is the outline. Now I hope you know what is drug interaction and what responses will be produced. We will be getting either a quantitative response or a qualitative response, and you might have understood why, in which conditions we are taking combination of drugs to treat various conditions, and we are taking more drugs to get a desirable effect, but it may impact and produce some unwanted responses. Okay, and this is the regular medications likely to be involved in drug interactions, like anti-diabetics, antihypertensives, anti-anginal, anti-arthritics, anti-epileptics, anti-Parkinson's, anti-coagulants, oral contraceptives, anti-asthmatics, psychopharmacological, antipeptics, drugs, corticosteroids, anti-tubercular drugs, and anti-HIV drugs. And mainly important drug interaction occurs with drugs with narrow margin of safety. Narrow margin of safety means their therapeutic index is less. That is aminoglycosides, digoxin and lithium. Next is drugs affecting the body functions like antihypertensives, antidiabetics, anticoagulants. Next is highly plasma protein bound drugs and drugs metabolized by saturation kinetics. So which are the drugs mostly involved in drug interaction? Drugs having low margin of safety, then which affect the body functions, which are highly bound to plasma proteins, and which are metabolized by saturation kinetics. Okay, now we are in this you should know what is drug interaction and what effect will be produced, and which are the conditions we are taking combination of drugs, and which drugs will be producing more drug interaction, type of drugs which will be producing clinically important drug interaction. Okay, next coming to the mechanism of drug interaction. Broadly we can divide the mechanism into pharmacokinetic drug interaction and pharmacodynamic drug interaction. Okay, in pharmacokinetic drug interaction, you know what kinetics means: absorption, distribution, metabolism and elimination. In pharmacokinetic drug interaction, it will be alter the concentration of drug at the site of action. what will happen in pharmacokinetic drug interaction? In pharmacokinetic drug interaction, it will be altering the concentration of drug at the site of action by affecting the absorption, distribution, metabolism or elimination. What is pharmacokinetic drug interaction? This type of interaction will alter the concentration of drug at the site of action by affecting the absorption, distribution, metabolism and elimination. Metabolism or elimination. Okay. So this pharmacokinetic drug interaction, there may be alteration in absorption. Then in the distribution, there may be displacement by plasma protein drug or by alteration in the drug binding to the tissues. It may induce or inhibit drug metabolism or altering the excretion. Pharmacokinetic drug interaction occurs due to altering the concentration of drug at the site of action by affecting the absorption, distribution, metabolism or excretion. How it occurs? There may be alteration of absorption or first pass metabolism. Displacement is the plasma protein bound drug. Then alteration of the drug binding to tissues. Inhibition or induction of metabolism or alteration of excretion. So let's discuss one by one. So first is absorption. We know if you're taking a drug orally, the drug has to get absorbed, and if you're taking two drugs together, the absorption of one drug may be interfered with by another drug. Example is if you're taking tetracycline with calcium or iron antacids or sucralfate, even milk preparations, milk you are taking with the tetracycline. Tetracycline is an antibiotic. Taking tetracyclines with calcium or iron salts, antacids or sucralfate, what it will be forming is, it will be forming an insoluble complex. That insoluble complex will be poorly absorbed from the gut lumen. Okay. Or what is the first example of this drug interaction which occur because of absorption? Example for absorption is tetracycline with the iron, calcium salts, antacids or sucralfate. It will be forming an insoluble complex in the gut lumen, so it will be poorly absorbed. Next is phenytoin. You know what is phenytoin? Phenytoin is an anti-epileptic drug. That phenytoin absorption is also decreased by sucralfate by binding in the GI lumen. How we can minimize this drug interaction is, we can minimize this by administering the drug with a gap of 2 to 3 hours. So first drug you have to take and you have to give a gap of 2 to 3 hours, and after that you can take the another drug. So the drug interaction which occurs because of absorption can be minimized by taking the drug at an interval of 2 to 3 hours so that it will not come in contact with each other. Similarly, we have some more examples for drug interaction which occurs due to alteration in the drug absorption. One is ketoconazole. Ketoconazole, its absorption will be reduced by H2 blockers and proton pump inhibitors. Actually, this H2 blockers and proton pump inhibitors, you know, these are anti-ulcer drugs. They will be reducing the gastric acidity, and if it reduce the acidity, it will be promoting the dissolution of ketoconazole, and it will be reducing the absorption of this drug. Okay, ketoconazole absorption will be reduced by H2 blockers and proton pump inhibitors because they reduce the acidity which promote the dissolution. Okay, next is antibiotics. If you are taking some antibiotics with the oral contraceptives, oral contraceptive failure occurs. You may think how this oral contraceptive failures occurs. Normally, while you are we know in our GIT some essential bacterial flora is there. This bacterial flora, what it will be doing is, once taking oral contraceptives, it will be deconjugated by gut flora, and it will be going for enterohepatic circulation. Okay, if you are taking oral contraceptives, the oral contraceptives will be deconjugated by the gut flora, then it will be entering into the bile as glucuronides, and there will be enterohepatic circulation. But if you are taking antibiotics like penicillins, like ampicillin, tetracycline, cotrimoxazole, it will be destroying the gut flora. Since it destroys the gut flora, this deconjugation does not occur, so the drug cannot undergo enterohepatic circulation. So the concentration of drug will be reduced and oral contraceptive failure occurs. Okay. Similarly, motility can be affected by drugs like atropine, tricyclic antidepressants, opioids, prokinetic drugs that also affect the absorption. What is this atropinic drugs? Atropinic drugs is anticholinergic drugs like atropine. We know they will be reducing the gastric motility. Similarly, opioids, that loperamide we are using for diarrhea. Then tricyclic antidepressants, they'll be reducing the gut motility. Next, prokinetic drug, they'll be enhancing the forward propulsion of the drug like cisapride, metoclopramide. They will be affecting the drug absorption. So drug absorption will be affected when you are giving one or two or more drugs together. We have studied some examples like tetracyclines with the calcium ion salts, phenytoin with sucralfate, then antibiotics with the oral contraceptives, ketoconazole with H2 blockers. Then if you are altering the gut motility also, the absorption of drug will be reduced. Next is drug distribution. What is the drug interaction occurs due to drug distribution? This occurs because of displacement of one drug from its binding sites on the plasma protein by another drug. We know the drug will be bound to the plasma proteins. Under distribution, we have studied most of the drug will be bound to the albumin. So once the drug is bound to the plasma protein, if another drug comes, it will be displacing the bound drug from the plasma protein bound site and it will be attaching to the site. So here we will be having drug interactions. What will happen is the displaced drug will be producing the drug interaction. This we can see with the drugs which are highly bound to the plasma protein like oral anticoagulants, sulfonylureas, NSAIDs and anti-epileptics. So which are the drugs mainly involved in drug displacement interactions? Oral coagulants, sulfonylureas, NSAIDs and anti-epileptics. You know, sulfonylureas are anti-diabetics, NSAIDs are non-steroidal anti-inflammatory drugs, anti-epileptic drugs, and these drugs are having small volume of distribution. In case of drug displacement interaction, already one drug is binding to one plasma protein and another one drug which is coming, if it is binding to the same site, it will be displacing the drug and it will be producing the drug interaction. So examples you can write. Quinidine will be reduce the binding of digoxin. Okay, quinidine will reduce the binding of digoxin and it doubling the dose of digoxin in the blood levels. Quinidine is an antiarrhythmic drug. Digoxin is a drug used in congestive heart failure. What this quinidine will do, quinidine will reduce the binding of digoxin to the plasma protein site. Because of that, the concentration of digoxin will be increased and it will lead to toxicity. Okay. Next is drug metabolism. Drug metabolism, we can give an outline. Drugs are metabolized by cytochrome P450 enzymes which are mainly present in the liver, and some drugs will enhance the metabolism of other drugs. If some drugs enhance the metabolism of other drugs, the drugs will be eliminated fastly and so we won't get the therapeutic effect what we are expecting. Some drugs will be inhibiting the metabolism, so they will be accumulating in the body and it will be leading to toxicities. And drugs which inhibit the metabolism of drugs are macrolides, azoles, antifungals, chloramphenicol. I hope you are not much familiar with these drugs, but you might have heard. the selective serotonin reuptake inhibitors, they will be inhibiting the metabolism of drugs. Next is one example they have given us statin induced myopathy. Myopathy will be occurring if a person is taking statin. Statins are used to lower blood sugar level. So the statin induced myopathy will be increased by fibrate, niacin, erythromycin due to inhibition of statin metabolism. If person is taking statin with the erythromycin, azoles, HIV protease inhibitors and all, what will happen? The metabolism of statin will be reduced and it will be leading to risk of myopathy. Okay. Next is even if you are taking two drugs together, one will be enhancing the metabolism of contraceptive drug, oral contraceptives, and leads to contraceptive failure. This is also example of drug metabolism you can write. And if you're giving the antibiotics together, one may induce the metabolism of other drug, that also leads to oral antibiotic failure. Next is drug interaction involving excretion. We know the drugs are mainly excreted through the kidney, okay, urine, and interaction mainly occur that for the drugs which are secreted by tubular transport mechanism. Some drugs will be inhibiting the secretion of drugs and some will be enhancing the secretion. Here, if you take probenecid, it will be inhibiting the tubular secretion of penicillin and cephalosporins. Okay, penicillin and cephalosporins secretion will be inhibited by probenecid. Thus, what will happen? If the secretion is inhibited, its plasma concentration will be increased and bioavailability can be increased. So, this is a beneficial drug interaction. Similarly, this probenecid will be decreasing the tubular secretion of methotrexate. Methotrexate is an anti-cancer drug that's also beneficial. If you're changing the pH, we can eliminate the drug which are useful in the treatment of poisoning. If you're taking an acidic drug and if you're alkalining the urine, what will happen? The acidic drug will be eliminated from the body. Similarly, in case of alkali poisoning, we have to acidify and it will be enhancing the poisoning, enhance the elimination of poisoning. So these are the various things, and under each heading you try to understand what is it and try to write some 3 or 4 points. The question will be write about pharmacokinetic drug interaction. If you are asked to write about pharmacokinetic drug interaction, you can write the pharmacokinetic drug interaction. Pharmacokinetic drug interaction, what will happen? It will be altering the concentration of the drug at the site of action. Okay, alter the concentration of the drug at the site of action by affecting absorption, distribution, metabolism or elimination. So you can write examples for each category. You know what is absorption, what is distribution, what is metabolism, and what is excretion. In absorption, the absorption of drug will be interfered by by forming some complexes. Okay. Next is in distribution. What will happen in distribution? It will be affecting the plasma protein binding. If two drugs bind to the same plasma protein, it will be one drug will be displacing the another drug and it will be leading to interaction. Next is metabolism. Metabolism, metabolism occurs because of cytochrome P450 enzymes, and the cytochrome P450 enzyme metabolism can be either inhibited or it can be stimulated by some drugs, and because of that we will be getting some either in favorable effects or some unfavorable effects we can get. Similarly, drug excretion. What is this drug excretion? Mainly drugs which are eliminated by tubular transport mechanisms will be affected, And example you can write about probenecid penicillins, cephalosporin bioavailability can be increased. Then poisoning, for treating poisoning we can alkalize the urine or acidify the urine to enhance the elimination of poisoning. Okay, so this pharmacokinetic drug interaction. It's easy only, so you understand the concept. What is this? First you should know what is drug interaction. Next, what are the various mechanisms involved in drug interactions. Now in this class we have studied about pharmacokinetic drug interaction, various pharmacokinetic drug interactions, examples. Okay, thank you.